Donald Trump promises to make America healthy again with a radical shakeup of health care. He's intertwined that vision with Robert F. Kennedy Jr.'s, tapping him for the top role in Health and Human Services. Here's what he told my colleague Vaughn Hilliard a day after the election.
To end the chronic disease epidemic, and President Trump has told me that he wants to see measurable, concrete results within 2 years in terms of a measurable diminishment in chronic disease. I'm going to do things that clean up the corruption in the agency. That's the real, we have 1,000 ingredients in our food that are illegal in Europe, that are illegal in other countries, and they're making our kids sick.
You would seek to ban fluoride in the U.S. water supply?
I think fluoride is on its way out. I knew in May of 2020 that the vaccines were not going to protect against transmission because I was actually reading the monkey studies.
He was talking about COVID, and while Kennedy's opposition to vaccines drove MAGA supporters to him, bigger picture, the New York Times reports that many Americans are actually open to a level of massive health care reform, believing the establishment has been, quote, dismissive and even corrupt. New York Times national correspondent Jack Healy wrote that. He joins us now. I also want to bring in infectious diseases physician and director of Boston University's Center on Infectious Diseases, Dr. Nahid Bhadelia, and former Governor John Kasich is back with us once again. So, Jack, people are clearly frustrated with the system as it is now, but is it clear from your conversations that what people want is a complete shakeup?
Some of them do. I think we should maybe start by talking about some baselines, which is that most Americans do trust their doctors and have a high degree of trust in the healthcare system. Even after COVID. But since COVID and since the pandemic, there has been some erosion in trust. And I think that RFK and Trump were able to capitalize on that sense of discontent, that sense of distrust that has festered since the pandemic, with rules on vaccines and lockdowns and some of the retrospective kind of quarterbacking that we've done of the pandemic restrictions. And those Americans we talked to after the election said that health was a huge part of their vote in this sense that they were just fed up with the status quo and really willing to vote for someone who was promising to blow a lot of it up.
And to that point, doctor, because trust is one part of it, but the system is another, right? Very few, if any, people get through life 100% healthy that they don't need a doctor to intervene. And once you do see the system up close, a lot of them quickly see how expensive it is, how inefficient and ineffective it can be. Numbers bear out, our high level of cost, low level of efficacy in some cases. But what would a complete shakeup mean in practice? This is complicated stuff.
It is. I'm so glad you said that, Chris, because I think I see Jack's point played out in many of the patients that I see, right? I think the patients' experiences here in the United States has been that their out-of-pocket costs have doubled in after inflation since 1970s. You still have huge amount of people who don't have timely access to preventative services. A shakeup requires something that's thoughtful for a complicated system in our nation that has an aging population. And truly, I think RFK Jr.'s sentiment hits a nerve because we are unhealthy. 70% of us are overweight or obese. We're still later than we should be in cancer screenings. But I think it's what's being suggested is these knee-jerk reactions, such as taking away the ACA, which may leave over 20 million people that are uninsured, or taking away people's confidence in vaccines, which may lead to more outbreaks, don't seem to be the kind of solutions that would make America healthy in the longer term.
Governor, you ran state government, so you know the level of red tape. Talk about the challenges legislatively to try to even fix basic coverage. There are parts that are out of legislative hands, including how many doctors you have and where, the number of doctors who are in specialties versus the number who do internal medicine or general practice. But talk about the challenges you saw firsthand.
Well, look, I think, first of all, when we were listening to both of these folks talk about this issue, I'm involved actually with public health and some reform of public health. The one thing I think we need to do is we need to separate science from policy. In other words, we need to have the science so people can trust what the science is with some dissenting. If somebody says, no, I don't buy that, let them have their say. But at the end, it's a large collection of people who say, we think this is what science says, and then let the policymakers make a decision. Don't try to squish them together. Don't push them together. And then the debate would go before policymakers. In terms of what's happening with health care, look, you don't know what the heck your copayment is. The whole system is so confusing to people. And access to primary care is absolutely critical, which is part of the reason why I expanded Medicaid. It's why John Hickenlooper, the former senator or the current senator from Colorado, and I went to Washington to talk about ways to fix the Affordable Care Act, Obamacare, that there are ways you can tweak it to make it more affordable, where you don't have companies trying to exit. There's lots of things we can do. But I think initially people are skeptical. But if we can have the strong science, if we know what that science is, and let policymakers make decisions based on that, I think it'll restore some confidence in the minds of people who go to see their health care professionals.
So, Doctor, you heard some of the things that RFK Jr. had to say. I mean, some are more controversial than others, but I think what has caught the attention of a lot of folks is the idea that we should spend more of our money on preventative health care, that we should be looking at keeping people healthy rather than trying to deal with them after they get sicker. Is that easier said than done?
Well, it's funny. We do have a science that helps with population health. It's called public health, right? And what's happened over the last 4 years is actually an erosion in public health bodies here in the United States, which I think will get in the way of that very goal, which is important, which is critical. I think that the reason that goal appeals to so many people is because we do need to do better. And part of the way that we do that is strengthen our public health system, which is chronically underfunded and is not ready to potentially, respond to a lot of the even in my field, emerging infectious diseases that are coming our way. So I think beyond that, the other part that we can do is actually look at our healthcare system to see how it's easier for people to get preventative care access before they end up in the emergency room. Emergency room visits have increased over 20% by 2019. For the 10 years before 2019, people are going there because they can't access their doctors and they can't get appointments. Working on how we improve the distribution of clinicians, reducing the times that patients have to go see their doctors is going to be an important quality measure. I would love to see the incoming administration work on those issues rather than just trying to gut existing agencies.
So, Governor, what do you think, understanding that some of the ideas that RFK Jr. has put forward are in the opinions of a lot of people, bringing about a much-needed discussion, given the level of frustration, given, frankly, that 1 in 12 adults right now are dealing with medical debt, according to a recent survey, and some of them can't buy clothes and food and other household items because their debt is so great. What can and should he say when he goes before the Senate to try to move the conversation forward in a smart way?
I think the idea that we want to treat people, keep them healthy rather than treat them when they're sick, something the doctor just said is ideal. There are programs in this country sponsored by health plans that have incentives to get people to primary care. So, in fact, we can treat them and keep them from being sicker than they would be if they got primary care. I think the other thing that Kennedy raises here is the issue of food. Could the food be healthier? Could it be safer? What about the issue of exercise? What about the question of obesity? These are all things that ought to be discussed. And I think you're going to find general agreement on that. But some of the other things that he talks about are things where you're going to have a debate between science and the people who study these issues, the issue of vaccines. There's going to be a lot of discussion. I think it's healthy to have discussions, but I think it's important that science itself, and that doesn't mean science is the be-all, end-all. That's why you have to have some disagreement within science. But if you operate on the basis of science, then people be more confident that no one's cooking the books. I can fundamentally believe in what they're telling me I need to do. But primary care is absolutely critical. Being able to integrate primary care with behavioral health would be another big advancement. I serve on a board now where they're trying to do that, the Bipartisan Policy Coalition, integrate behavioral health with public health or with primary care be a huge plus for our country to keep people's costs down. If you don't have good mental health, usually you don't have good physical health. There's so much to do. And it's exciting, Chris. It's exciting in the age of AI, what we're going to be able to find out about disease. Let's shake it up a little bit, but let's not throw the baby out with the bathwater. I think that's what the doctor's saying. I agree with her.